Let's notice, because this term has been used many times here, but probably was not understood with all its consequences, namely, that there is nothing more pleasant in human life than the absence of the anxiety. So the GPS person, GPS meaning genetically determined polysymbolicity, simultaneous polysymbolicity, schizophrenia. So the GPS person kind of prefers the anxiety-free periods to the normal, anxious ones. Hence, a great difficulty in the real therapy of the GPS people. The real therapy could take away what is a blessing for them, anxiety-free periods. But those among them who are veterans of psychiatry know very well that such an effective therapy does not exist. In the contrary, the current psychiatry, by extending the anxiety-free periods with the use of anxiolytic drugs, meets the hidden aspirations of GPS patients who do not want to change anything. And this is a significant difference between GPS and IPS patients. IPS meaning induced simultaneous polysymbolicity schizophrenia. For IPS patients, do not have genetically determined anxiety-free periods, and they do not have the secret desire to stay as they are. If IPS people, on the contrary, in view of the poor possibilities to develop the anti-anxiety arsenal, the obvious property in hospital conditions, these people are consumed by the anxiety and enormous desire to overcome this situation. Unfortunately, if they are misdiagnosed and treated like GPS people, they are being calmed down by increasing doses of anti-anxiety medications. What's more, psychiatrists functioning without any scientific doctrine consider these patients as particularly dangerous to themselves and to the environment. What an irony! They consider the PS syndrome, simultaneous polysymbolicity schizophrenia syndrome, to be extremely deep and resistant, requiring many years of the therapy. They consider the PS syndrome of such people with induced polysymbolicity, simultaneous polysymbolicity schizophrenia. Thus, a terrible paradox is happening in psychiatric hospitals all over the world. A tragedy of a multi-million scale which that the world doesn't know about and maybe even doesn't want to know about. The tragedy is that in the closed wards, often in the solitary confinement, they stay for several thousand years, people with IPS, induced simultaneous polysymbolicity schizophrenia, until they give up, and the healthy people will be forced to accept playing the role of mentally sick. Yes, healthy, at least for the first years, before the system and drugs break their health. And in open wards or in social housing outside hospitals, there are GPS patients eagerly and meticulously accepting the anxiety therapy offered to them. Sometimes they will create a conflict situation, which is understandable because during the anxiety free periods, there is no break in the behavior, even the most ridiculous, especially when inspired by parallel symbolic psyche, PSPM. Then they go back to the psychiatric hospitals where everything will be done so that they can continue undisturbed to enjoy the bliss of their anxiety free periods. This is how the current system works, globally, all over the world. Yes, there is some kind of humanitarianism in the fact that people with GPS have a possibility to live without the need to take the trouble of normal, family, professional, and social existence. Or is it a distorted humanitarianism? The more distorted, that at the same time millions of IPS people are forced to stay in the psychiatric hospitals in the name, well, in the name of what? Of pseudoscience. Would a real honest science allow this? No. The thesis of these lectures and of my books are a preview of this. So in the PS adaptive therapy, simultaneous polysymbolicity, schizophrenia, the most important and the most difficult task is to motivate the GPS people, patients, to live a blissful, almost completely anxiety-free life, to stop it. I note that in the anxiety-free periods, it's by definition free of the anxiety. They are free of anxiety. In the anxiety periods, however, they are also anxiety-free because of the erroneous psychiatric paradigm that combats anxiety periods with the drugs used in PS. Of course, GPS patients, unlike IPS patients, are eager to take these drugs because what could you want more than more and more? What could you want more than more and more anxiety-free bliss? The lack of a scientific theory of the psyche has led to the absurd situation in which doctors become unconsciously distributors of the psychoactive substances, having no scientific vision of the psyche and its disorders. But unfortunately, psychoactive, not in the sense of restoring a GPS person to the normal functioning, but on the contrary, there is always a progressive degradation of all social competences of the GPS people.